हमें इंटरेस्टेड बनाना ही हमारा काम है, क्योंकि स्टडी तभी होगी अगर हम उसको इंटरेस्टेड बनाएंगे। तो बहुत 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 स्टूडेंट्स को ये बहुत बोरिंग लगता है। तो आज थोड़ा इंटरेस्टिंग करने की कोशिश करेंगे। तो सबसे पहले आप आवरण कहा जाता है उसमें किसी और दोष के कारण। अंडरस्टूड? बात क्या है? बात का बात दोष क्या हो जाता है इसमें? बात दोष का क्या हो जाता है? बात दोष गेट एनवायरमेंट आप क्या हुआ आप
Audible. Okay. So another 5 10 minutes we'll start, sir.
No problem.
Our students have joined in single screen.
Okay.
Okay. Another 5 10 minutes.
Yeah, yeah.
Om Shri Gurubhyo Namaha. Very good afternoon to everyone. Myself, Dr. Mathias, final year PG scholar. On behalf of the Department of Panchakarma, Tarnath Government Ayurvedic Medical College, respected principal, distinguished guest speaker, Dr. Sanjay Kadlimatti sir, and our respected HOD sir, Dr. Santosh L. Edaldi sir, and esteemed faculty members, postgraduate scholars, and all the participants joining us for today's webinar on decoding Avarana from fundamental principles to clinical practice. As we know that Avarana is one of the most important and challenging concepts in Ayurveda, understanding its principles and clinical relevance is essential for accurate diagnosis and successful treatment. So we are privileged to have with us an eminent academician and clinician who will guide us through this fascinating topic. So now it's my privilege to introduce today's esteemed resource person, Dr. Sanjay M. Kadlimatti sir. Sir has completed his BMS from SVM Ayurvedic Medical College and MD in Kaya Chikitsa from Ayurveda Mahavidyalaya, Hubballi. So he also holds a postgraduate diploma in yoga and naturopathy and earned his PhD from the Institute of Postgraduate Teaching and Research in Ayurveda, Gujarat Ayurveda University, Jamnagar, where he carried out pioneering research on Tiktakshirabasti and Rasayana in Astikshaya, that is in osteoporosis. That is the first PhD thesis in Ayurveda dedicated to osteoporosis. With over 20 years of academic, clinical, and research experience, he is presently serving as Professor of Kaya Chikitsa and Hospital Administrator at BLDAS ADS Ayurveda Mahavidyalaya Hospital and Research Center, Vijayapur, Karnataka. He has served in several prestigious institutions across Karnataka and Kerala, including as principal of BLDS AVS Ayurveda Mahavidyalaya for more than 8 years. Dr. Kadlimatti sir has received numerous prestigious recognitions, including the Silver Medal in BMS, Best Teacher Award, that is Adhyapaka Bhushan Award, and Vidya Bhushan Award, and several Best Paper Presentation Award at both national and international conferences. His academic contributions include 27 peer-reviewed publications and more than 132 invited lectures as a resource person and participation in 9 television and radio programs. He has also served as an expert panel member for CCRS projects, institutional ethical committee member, reviewer for reputed journals, and PG and PhD examination. Excellence makes him an ideal guide for today's topic. Sir, we are truly honored by your gracious presence. On behalf of the Department of Panchakarma, TJMC Ballari, I extend a warm welcome to you, sir. Before we begin, I kindly request all the participants to kindly keep themselves on mute throughout this session. If you have any questions, please type them in a chat box. The question and answer session will be held at the end of the lecture, where your queries will be addressed. With these few words, I request our esteemed speaker to kindly commence the session. Over to you, sir.
Afternoon. I hope my slides are visible and I'm audible.
Yes, sir. Yes, sir.
Okay. Shri Gurubhyo Namaha. Respected principal, faculty members, especially of the Department of Panchakarma, of the prestigious Sri Taranath Government Ayurvedic College, Bellary. It gives me an immense pleasure to be part of this webinar series going on. And the topic allotted me is, I'm very much afraid of this topic, and this topic only has been given to me because after almost 12, 13 years, I'm representing this. I mean, we are teaching it obviously, but decoding this Avarana with the fundamental principles to clinical practice is a very tedious task. We know Avarana is a very untouched topic, but still I would like to thank to my dear friend Dr. Santosh and other faculty members, Dr. Hugar, for giving me the opportunity. I'll try to just to my topic. So without wasting much time, let us decode Avarana. Or in other words, let us do Anavarana of Avarana from the fundamental principles to the clinical practice. See, Avarana, it's a unique concept related to Vata Dosha. We all know that. And when we see these pictures, I have put 3 pictures here. The first one shows the Vata moving inside the Avaraka. If you all remember, this is what happens in Staulya. Medasvino medaiva upachiyate na itaretara datavaha. And Vayu, because of the Avarana of the Meda, is doing Kundalakara circulations in the Shamana Vayu place. That is why it will be Atik Shuddha and Atik Trishna. Now here the circle denotes Avaraka, which covers, and inside this light blue color Vayu is the Avrita or Avarita. Many students fail to understand this only, what is Avrita and what is Avaraka, but if you coolly think with some time given, it is very easy to understand that which is covered is called as Avrita, which is doing the covering is called as the Avaraka. You may be wondering why I put this balloon. This thought came to my mind long back while thinking about Avarana. We all have played with the balloons in our childhood, and now also during some birthday parties and all we do this. We blow air into the balloon and we tie a knot at its opening so that the air remains inside the balloon. So what is happening is exactly Avarana happening. The Vayu inside the balloon.
Sorry for interruption.
Sorry.
Can you put the slideshow more?
Yes. Is it lesson?
Yes.
Yeah. Sorry for that. Okay. So balloon, when we fill the air inside the balloon acts as an Avaraka, and Vayu is Avrita by the balloon. Now, very simple question that we would ask here is, what if we keep on blowing the air into the balloon beyond its capacity? Once the air is blown beyond the capacity of the balloon's strength of the rubber, it blasts the balloon and the air is let free with a blast, where there may be some damage to the nearby, maybe some particles which are present in the air, they will be speedily thrown into the circle, into the environment. So the point of telling this was, if at all Vayu is weak and the Avaraka is strong, then only Avarana happens, which is very rare. Because we know in Vata Kalakali Adhyaya, 12th of Sutrasthana, Vata is said to be Vibhu, Vishnu, Prabhu, Mahajava, Tantra Yantradaraha. So all the other dhatus and doshas are Pangu. Pittam Pangu, Kapha Pangu, we all know this. So this Vata to be Avarita, to cover this Vayu, we need a very strong pathological aspect of the Avaraka. Without that, it is not present. So initially what happens when the Vayu is weak, the Avaraka is strong, there may be the covering happening. But look at the balloon after 1 week. It will shrink itself or it may blast open also. That means Vata inside the Avarana is trying hard to move because the Pratyatma Lakshana of Vayu is Chalaguna. You cannot hold Vayu. It is always freely moving. It is Chala. Others are Pangu. Vayuna yatra niyante tatra gachanti megavat. Now the third diagram, whatever I told till now, if somebody doesn't understand, means this Avarana topic is such a topic that it's so complex that it may cause Buddhi Avarana also. May it be the Bishak, may it be the Vidyarthi, or may it be any person who is dealing with Avarana. If the concept is not understood properly, if we don't give logical interpretation for the concepts of Avarana, maybe Annanya Avarana or Dosha Avarana, Annavarana, Mala Avarana, etc., that pathology itself is so complex. It's a unique concept in Ayurveda that if we don't understand that this concept may occur, cause buddhi avarana of the person who is perceiving it. That's why I put these three circles. Now, why Vata is unique in the body? Because I have to deal from the basics up to the clinical aspects. So far, we have time. Vata is a unique dosha which differs from other doshas in many ways. Number one, it is asanghatavanta and anavastita. Whereas others two doshas are sanghatavanta, they have some form and they are avasthita. They can be physically experienced. Whereas in the 12th chapter of Sutrasthana, again Vata Kalakaledhya, the sloka starts with Katam Tenam Sanghatavanta Manavastita Manasadhya. So how can something which is non-existent and not stable, anavastita means it is always moving, chanchala. So Vayu is not having any form, shape, and it is not stable. Number two, it is avyakta, but its karmas are vyakta. Avyakto vyakta karmacha. Very beautifully it is told. Even though we cannot see the Vayu, its karmas are experienceable, visible, or vyakta. For example, some of you may be sitting below the fan. You cannot see the air, but you will feel the air. That is what it is, avyakta vyakta karmacha. It is the one which moves the kapha, dhatu, malas, which are pangu, as per its will. Vayuna yatraniyante. Wherever it wants, it can take. So it's having absolute freedom. That's why I have written the word as per its will. Lastly, we know in Charaka Chikitsa 3, that is Jara, Yogavaha Param Vayu Sanyoga Tubhyartakrat. Vayu is Parama Yogavahi. Why I'm telling Yogavahi? Because even though the Atma Guna of Vayu is Shita, Tatra Ruksha Lagu Shitaha, but when mixes with somebody, it is the one which quickly attains the qualities of the thing that has mixed with. That is why in Avarana, may it be the Pitta Avarana, Kapha Avarana, Dhatu Avarana, or Mala Avarana, or Annanya Avarana. First and foremost, we always see the symptoms of Avaraka because Vayu is initially weak. That's why it has been covered. If it is strong, you cannot cover it. For example, now if there is any severe thunderstorms with heavy speed winds, the advertisement boards, the metal sheets on the huts in some villages will all fly away. So strong Vayu, 100% no chance of Avarana. Weak Vayu, chance of Avarana. And Vayu being Parama Yoga Vahi will quickly attain the qualities of the thing which has been mixed with. That's why Sanyogat Ubhayartakrit, Dahakrit, Tejasa Yuktam, Shitakrit Soma Samshrayat, Charakachikitsa 3. So while mixing with Pitta, it creates heat, and while mixing with Kapha, it causes Shitata. We all know it is Yantra Tantra Dhara. Vayu is Tantra Yantra Dharaha. It also is there in the same sloka. And look at this sloka, what I have written in Sanskrit. Tell me one dhatu, dosha, or mala, which has been given so much of high praising words and which is worshipped like a god. None of them. Even though rasa, rakta, oja, shukra, pitta, kapha, none of them have been given so much of importance like the words used for the Vayu in the same chapter. Look at them. Bhagavan, Prabhava, Avyascha, Bhutanam, Bhava, Bhavakaraha, Sukha, Sukha, your Vidata, Mrityuhu. See, Vayu is called as Mrityu. Vayu is called as Yama, Niyanta, Prajapati, Aditi, Vishwakarma, Vishwarupa, Sarvaga. So go on reading Vishnu, Vibhu, Pranta, Lokanam. So much of high praise what has been given that indicates that how important the dosha is for our maintenance of health as well as for the cause of the disease. Why Avarana is a complex thing? Why complexity of Avarana is so much felt by the students and teachers? The victim dosha is only one. I hope you understand the victim dosha. The Avrata dosha is only one. That is Vata. Avarakas are many. Avarakas are many. So basically, a student feels so much irritated that how can so many avarakas to one avrata, how can we understand the symptoms? And in which place, which avarana is going to happen? Such a tedious job. That is why this single concept is very complex. Assessment of avarana is not at all easy because one has to dive deep into the concepts of the sukshma parameters, minutest parameters, and then understand avarana. And that too, after diving deep into the sukshma parameters, sometimes assessor fails to exactly understand because vata is chanchala. Vata is chanchala. It is having anavastita guna. It behaves weird. You cannot expect that to be happening like this only. That is why Avarana is very complex pathology happening inside the body. Now the concept of unknown Avarana is further enigmatic. I always ask students my students the question. See, balloon and air understood. How can one air do the Avarana of another air? Both are amurta. Both are not visible. Both are not existing. Only its functions are felt. So this unknown avarana, I use the word enigmatic because it is very complex that you cannot imagine amurta tattva, one amurta tattva doing the avarana of the another amurta tattva. Many of the students attending this webinar may have this doubt. So I will clear it in the future that all the three Mahan Acharyas, Charaka Shristava, but I have cleared this concept. How can a Amurta Dravya cause the avarana of the another Amurta Dravya? That I will tell in the further slides. So avarana caused by the dosha, dusha, malas and anna can be understood easily because something solid or something existent is doing the avarana of the air which is not existent. But Amurta Vata of sub-avaranas is difficult. Let's move on. According to Acharya Sushruta, Vata has three pathological manifestations. See, Vata has three pathological manifestations. Kevalo, doshayukto va, dhatubihi va, avrto anilaha, vidneyo lakshano lakshana uhabhyam. See, uhabhyam means you have to guess because lakshanas are sometimes very tedious. Pratyaksha is not possible. Uha, guessing. Chikitsascha avirodataha. So Kevala Vata is one pathological manifestation. Dosha Yukta Vata is another pathological manifestation like Samsarga and Sannipata. I was requested by the organizer to speak about Samsarga and Sannipata also so that you can understand the difference between Samsarga and Sannipata as well as Avarana. The third pathological manifestation of Vata as per Acharya Sushruta is Avrata Vata, caused by the covering obstruction of the path of Vayu. See the Charaka's view in 28. Sarveshu eteshu samsargam pityaddehi upalakshayet. See, in all the samsargas, pittadi, any samsarga, pitta, kapha, vidosha, sannipata, can be felt in Vata Vyadhi. But the two major pathological processes happening for the manifestation of Vata Vyadhi are Vayor Dhatukshayat, Opo, Margasya, Avaranena, Cha, and Avaranena Va. Many people will not give importance to these two last words, that is Cha and Va. Many people will not understand why they have put. But it's very practical clinically very important because ch denotes and, va denotes or. So ask the teachers present in this webinar, they will definitely agree that in their clinical practice, once in their lifetime, they have come across patients who will be confusing whether there is dhatukshaya or avarana. That means both can coexist in one patient. Both can coexist in one patient. That is why there is cha. Means vata prakopa in one patient may occur because of dhatukshaya and margavarana. That's why cha is used. Other option is you may see patients where there is dhatukshaya or it is otherwise margavarana. That is why there is a va put in the bracket or. That is why not even a single word in Samhita is nice to know or desired to know. Everything is must to know. Because if you want to be a clinical practitioner, Samhitas are the basic requirements where you will understand the minuteness of even adding a single letter like cha and va makes importance. Because if you consider a patient who is having both the pathologies and if you treat only one, it will not going to give you results. That's why there you have to do the Vyatyasika Chikitsa. I will tell you what is Vyatyasika Chikitsa at the later stage. Means you have to treat both Margavarana as well as Dhatukshaya, which is a Vyatyasika Chikitsa, contradictory treatments on and often to bring back the patient to healthy status. Vata Pitta Kafadehe Sarvasoto Anusarinaha. Yes, we all know. The shloka says that Sarva Sharira Charastu Vata Pitta Seshuno hi Sarvasmin. Kupita Kupita Shubha Shubhani Kurvanti. Maybe in Maharoga Adhyaya somewhere it's given. Like that, here also Charaka says in Vata Vedi that Vata Pitta Kapha Dehe Sarva Shoto Anusarinaha. That's why there is no Vata Vashotas, there is no Pitta Vashotas, there is no Kapha Vashotas. Among the 13, you have only other 13 Shotas except Vata Pitta Kapha because Vata Pitta Kapha are free to move anywhere in the whole body. Vayureva hi sukshmatvad dvayos tatra api udiranaha. See, udirana means aggravator, increases. Vata is the culprit. That dvayo, both pitta and kapha, will be vitiated by very easily by vayu because it is sukshma. It can enter into anybody, any shotas or any kapha or pitta. Kupitastau samudhuya tatra tatra kshipan gadan. So this kupita, complex of pathology mixed with vata, pitta and kapha, tatra tatra kshipan gadan, wherever it is thrown into the circulation by the vyana vayu, kupita nami dosha nam sharire paridavatam, wherever it is thrown, yatra sangaha kavagunyat, karoti avrata margatvat rasadimscha upashoshaye. Same thing. There it is kavagunya, shotoroda, here it is avrata margatvat. Once there is avarana happened, because of this complex pathology of vata, pitta and kapha, rasadimscha upashoshayet. Rasadimscha upashoshayet. What is it? You cannot do the shoshan of the rasa, rakta, mansameda until you are into the last stage of rajaksha. So dhatukshayatiti, see, adi means, I have taken the commentary of Chakrapani, pitta, kapha, rakta, purishadibihi, can mix with vayu. Now, avratasya vayoho katam kupitatvam bhavati yavata avruto durbalaha. See, we said avrata is durbala, but still, how can vata get kupita is the question. Katam means how. The answer given is dhatukshayaditi sarakshayatvat. Or initially, the avaraka is strong, that's why you see the symptoms of avaraka. But later, because vata is every day fighting to come out. So once it is fighting, it gains strength and it will show its symptoms later. So that is the way vata symptoms are seen, latent stage, not in the early stage. Dhatukshaya will not happen until there is a sarakshaya. So sarakshaya concept is there in Staulya. Sarakshaya concept is there in the Santarpanutta vikaras like Pandu. So here also sarakshaya will be there. And whenever we say margavarana, second nidana for Vata Vyadi. The meaning of Marga Avarana is beautifully told by Chakrapani, saying that Vega Patibanda Deva Kupito Bhavati. You imagine a small child wandering here and there, playing here and there. You hold him tightly for a few minutes, or you tie him with a rope to some cot or somewhere. He starts agitating. He gets irritated. He starts crying, screaming. Similarly, same thing happens with Vayu. The dosha which was meant for free movement all over the body, if there is a vega pratibandha, if somebody obstructs its speed, it gets angry. Kupito bhavati. Ata bhavatu marga rodatva vata kopaha. This is the reason for marga varnajanya vata kopa. Avarakena pittena kafena chasya katamna sambandho. So this is not that important for now. But we have seen a very important point about dhatukshay and avarana. Let's move on. See, Shuddha Vata disorders, because this chapter 28 or even because Charaka only has majority told in 28 is separate, but if you look at Akstangrudha and Sangraha, they have included this Avarana into Vata Shonika, and Shushruta combines Urustamba, Vata Vyadi and Vata Shonika in one chapter, where the pathology is totally different. So not because I'm Kayachikitsa person, I feel Charaka was more clear in the concepts. He divided Urustamba, Vata Vyadi and Vata Shonita because the involvement of doshas, the pathology that is happening and the treatment totally were different in these three conditions. So when we say Nanatmaja Vyadi, if you split the Sandhi, Samasa, Na, An, Atmaja, I have striped off Na and An, then you can get only Atmaja. That means it is a pure soulful diseases of the Atma, pure diseases of Vata. No involvement of any Samsarga and Sannipata here. Even then we see Vata Kapha Gurudrasi. Remember this is a different concept. Even then we see Vata Kapha Gurudrasi or some other conditions, but there it is a different concept. We will be dealing with it in the neurological conditions, this is not the topic for discussion. So pure Vata disorders, Vata Eva Vyadi. This is in the commentary of the first sloka itself of Charaka Chikitsa 28. So Chakrapani tries to answer what is Nanatmaja. He says Vata Eva Vyadi, Kinchit Kuchlok. Some people will say that Vata Eva Vyadi means Vata itself is Vyadi. Obviously, nobody will agree with this because Prakrita Vayu will help you to sustain the life. That's why Vata cannot be called as Vyadi. Obviously, Vikruta Vata can be Vyadi, but Prakrita Vata is not Vyadi. That is why second people said, okay, once you denied this, then my definition is Vikruta Vata Janita Vyadi. Vikruta Vata Janita is Vata Vyadi. That means what about Vata Gulma? What about Vata Rakta Pitta? Means Vata associated Kapha Rakta Pitta. It's Adoga Rakta Pitta. What about Vata Jara? What about Vata Pandu? Then what is the difference between Nanatmaja Vata Vyadis and Vata Pandu, Vata Gulma? That's why the third and the best definition of Nanatmaja Vyadi is Vikrita Vata Janito Asadharana Vyadi. Pandu, Gulma, Jara, Visarpa, etc. will be called as Sadharana Vyadis. That means Vata is also causing, Pitta is also causing, Kapha is also causing. Whereas Nanatmaja means, Na Anatmaja means Vikrita Vata Janito Asadharana Vyadi. It should be an extraordinary disease. It should not be an ordinary disease that will be caused by other doshas also. Now, Samsarga and Sannipata. Vata combining with other doshas is called as Samsarga. Whenever there are two combinations, you can call it as Samsarga, and you can call, when there is a combination, it's a Sannipata. If anybody interested for a question, you can type in the message chat box. Is there Sannipata Gulma or something else Gulma? And is there Sannipata Udara or something else Udara? There are two things, two diseases where Charaka uses a different word for Sannipata Gulma and Sannipata Udara. You want, if you're interested, you can type. I can tell it when it comes to the concept of this one. What is the difference between that and this? Now, the Vata may be either associated with Pitta or Kapha, or both due to combined Hetu Sevana. See here, Hetu 7 is combined. That means Vatavardaka Hetu, Pittavardaka Hetu, Vatavardaka Hetu, Kaphavardaka Hetu, or Vata Pitta Kaphavardaka Hetu. Here itself it is Sannipata and Samsarga. Sannipata and Samsarga. Wonderful. There are some answers already given. Nichaya Gulma. Good. Our participants are very active. Nichaya Gulma. Nichayodari. Tatra Nichayodari. Nichayodara is there. Okay. So I'll come to that point. Synergistic Lakshanas. What happens in Samsarga and Sannipata is the combined Lakshanas of Vata Pitta, Vata Kapha, or Vata Pitta Kapha will be seen involving in the pathology of that disease. How to understand what dominant Lakshanas are there? The dominance of dosha Lakshanas always depend in Samsarga and Sannipata based on the Taratama Bhava. Like you see Rajakshma, you see Kushta, Sarvastri Doshajo Yakshma Doshanam to Balabalam. Sarvastri Doshajo Kushta Doshanam to Balabalam. So Doshanam to Balabalam is important. Taratama Bhava. Who is very strong will exhibit the symptoms more. Even treatment should be logically planned accordingly. That means based on the Taratama Bhava only, you are supposed to plan the treatment. Now coming to the point I told, that is symptoms in Samsarga and Sannipata. Samsarga or Sannipata may occur in a simple way, means Sama-Samavet way. Sama-Samavet. Means Vata Pitta are together, you see Vata Lakshanas, Pitta Lakshanas, Sama-Samavet, Prakriti Sama-Samavet. No problem in that. Like a physical mixture of doshas. Here what happens is, the mixed symptoms of both the involved doshas are manifested. You can divide, these are the Vata symptoms, these are the Pitta symptoms. Kruksha, Shava, Aruna Varnata is Vata symptoms. Then Atisveda, Daha, these are the Pitta symptoms, like that. In such conditions, the symptom of Sannipata and Sansarga Vyadhi are not described separately. Can you see Dudosha Gulma symptoms explained in Charaka? No. Because it is Prakriti Sama-Samavet. But Dudosha Gulma will happen. See the Chikittasana. There are Dudosha Gulmas, but symptoms are not mentioned just because they are not separately explained because of the concept of Prakriti Sama-Samavet. Even in Sannipata, for the students, very easy type of disease is Sannipata. What is the Lakshanas? Combined Lakshanas of Vata, Pitta, Kapha are the symptoms of Sannipata Jara, like that they will say. Now coming to this point, see, here in the Gulma. If my cursor is visible, or else also you can just see here. Iha kalu panchagulma bhavanti tadyata vata pitta sleshma nichaya gulma. No Sannipata gulma. Nichaya gulma. Last one is Swanita gulma. Now why nichaya is what is used? Nobody cares this, but it's very important, I'm telling you, for the clinical practice. See here. Commentary, I have marked it in yellow. Nichaya Sannipata. So both are same, means what is the difference then? Nichaya is also Sannipata. But there should be something different. What is different? Iha pratyeka vatadi gulma kriya melakadeva dvandvaja gulmaha sadhyanti iti krutva na prataguptaha. See, dvandvaja gulma in gulma chikitsa is not told because the symptoms are vatadi gulma kriya melaka, combined gunas of vata pitta. That's why it is sadhya. You can treat vata pitta. But Sannipata gulmastu vatadi gulma kriya melakena sadhyo na bhavati. Very important. See, Chakrapani is telling you very clearly that in Sannipata gulma only, or in Sannipata udara also, because there is also the word used is nichaya. Here in this slide, in Sannipata gulma, vatadi gulma kriya melakena, if you give the treatment of combined of vata, pitta and kapha, sadhyo na bhavati. It cannot be cured. Vatadi sanyoga mahimnaha tena atirikta sadhyatvad asadhyatvad yoga nichaya gulma prataguktaha. See, take home message. when the Sannipata can be treated by the individual treatments of Vata, Pitta, Kapha together combined, then it is Sannipata Gulma. If some disease cannot be treated by the combined treatment of Vata, Pitta and Kapha, it has some special lakshanas and it needs some special treatment, then it is called as Nichaya. This is the important understanding of the difference between Nichaya and Sannipata. I hope it's clear. Let's move on. Now, one more basic principle what I was asked is, students are always confused. Sir, what is the difference between Gata Vata and Avrata Vata? Easy actually. And some students will ask me, what is the difference between Marga Avarana and Avarana? Just, Srotoroda and Avarana. But here are some answers. See, if the vitiated Vata follows a specific pathogenesis, wherein what it does, it will be moving to some specific sites like dhatu, upadhatu, or ashaya, or an organ part, then such condition is called as Gata Vata. Vata itself is going because of its chalaguna. There is a specific pathogenesis where Vata itself is moving is called as Gata Vata. Example I have given here, Patpashaya Gata Vata, etc., etc. But in Avarana, what happens? It's exactly opposite. The movement of Vata dosha is hampered by the other doshas, dhatus, malas, or anna, or between themselves, because they cover it. They do the Avarana. Freely moving healthy Vata will not cause any problems. Shubha Shubhani Kurvanti. Freely moving Shubha Kurvanti, obstructed Ashubhani Kurvanti. Once its gati is hampered, then it gradually aggravates and causes distress. Further to see, if you look into the next loka, that is Avarana. Next slide, that is we come to know the Avarana. The name is very easy: cover, mask, or to obstruct. Even it's a Kannada word, Avarana. Gati is a unique feature of Vayu. When gati is disturbed, then Vata vitiation occurs in the form of Avarana. Now, for Avarana to manifest as a special pathogenesis, this is very important. Listen carefully. For an Avarana to happen inside the body as a special pathogenesis, the Avaraka must be relatively stronger than the Vata dosha. This I have been telling third time. If the Bala of Vata is overpowered by the Bala of the Avaraka, then only Avarana can occur, or else it is very difficult to restrict the mighty Vata dosha. It's impossible. So if I'm seeing 20 to 30% a day, till now, except one or two, I would have not said it may be Avarana. Means I would have felt inside my mind that it may be Avarana, maybe Purustamba, like the Lane-Berry syndrome, like Prameha, Stula Pramehi, or Vatarakta. There we may see some Avarana-like symptoms, or else it is very difficult. Hence, the disorders of Avarika Vata are produced by indulging in the etiological factors of Avaraka for a long time. For example, Pitta Vrata Vata. There will be no hetu for Vata Dushti here. I repeat, example Pitta Vrata Vata, no hetu for Vata Vikara. All the 100% nidanas are gradual intake of Avaraka, that is Pitta, for a long time. If Pitta increases beyond Vayu, then it may cause Avarana. Types of Avarana. This also theory we all know. So, but first Astanga Hridaya, Vagbhata says, Avarana may be innumerable in number. The reason why he gives along with the commentator, Dalana, saying that because there are 63 more permutation combinations of 13 permutation combinations of Sannipata. Then if you go for the subtypes, because Ashtanga has told subtypes of all the 5, Vata, Pitta, Kapha. Charaka has told only 5, that is Vata. Pitta, Kapha subtypes have been not told by Charaka. So the concept of Ashtanga Hridaya saying innumerable means based on Taradama Bhava, based on the types, based on the permutation combinations, the Avarakas may be innumerable. Whereas 42 Avaranas which have been studied or observed by the Acharya Charaka Shushitva and Vagbhata, there is no controversy in the numbers. but 42 have been explained in the Samhitas. The avarana of the Vata can be caused by the dosha, dhatu, mala, anna, and even by the anyonya avarana. So here 12 types of avarana, I call them as murta avarana. See, avarana is again two types, murta and amurta. Very easy. Murta, which is covered by something which has shape and existence, like pitta vrata vata 1, kapha vrata 1, rakta shukra and sarva dhatu vata 7, purisha 1, mutra 1, anna 1. Now, I will spend some time here. Why dhatu avarana started with the rakta? Why nobody has mentioned rasa avrata vata? Maybe nobody has asked the question to the teachers and they have not answered. But if they ask questions, there is an answer for this. Some teachers who have depth deep into the avarana will tell the answer for this. The reason is very simple. See, as per Ayurveda, blood never circulates. It is a modern concept that blood circulates. In Ayurveda, in our science, the thing that circulates all over the body is rasa. It is rasa samvahana. And also in Vyana Vayu's definition in Charak Samhita, Vyanena rasadhaturhi vikshepochita karmanaha. Rasadhaturi, not raktadhaturi. So rasa is a basic factor which acts as a vehicle for vata to move. Hence, your own vehicle cannot obstruct you. That is why acharyas were very intelligent enough to exclude rasa vrata vata, because rasa cannot cause avarana of vayu, because rasa is a vehicle where vata, pitta, kapha, nutrients, etc. are circulated in the rasa only. It's adya rasa dhatu. That is why there is no concept of rasa vrata vata. And one more reason what I have experienced is in the Vruddhiksha Lakshanas of rasa and kapha, the shloka starts with rasoapi sleshmavat. Rasoapi sleshmavat. And if you consider the treatment of rasa pradosha vikara and also treatment of amasya samudbhava vikara, treatment of urdhva amasya kafasthana vikara, sarvam langanam aushadam. So somewhere we have to connect the dots to understand that rasa cannot do the avarana of vayu. Maybe it's a vehicle. And also some symptoms of rasa can be understood based on the kapha vrata vata also. This is my understanding. Nowhere in the comment it is given. I may be wrong also. So take it as you want. 10 types of another murta avaranas are, we all know that pitta and kapha not only does the pradhana vayu avarana, it also does the subtypes of avarana of vayu, that is prana, udana, samana, vyana, apana. Similarly, kapha does the avarana of the 5 types of vayu. So these 10 are also called as murta avarana because pitta and kapha are murta. Now coming to the amurta, is anyonya avarana. Each prana, udana, samana, vyana, apana will do the avarana of the rest of the 4 types of vayus. So 5 into 4, 20. This we call it as amurta avarana because there is no any shape or existence for both the avarakas and avrata. That's why it is amurta avarana. Now, according to Chakrapani, excessively increased strong avaraka suppresses the normal action of avarta vata. That is vata. Now, this excessively increased strong avaraka manifests its symptoms first. And there should be karma hani of vayu because it is covered. It has been tied. So that will be karma hani. Whereas there will be karma vruddhi of the avaraka. This is the commentary of Chakrapani. Atra avaryanam baliyasa avaranat swakarma hanir bhavati. See, avarya, weak, avaraka, baliyasa, strong, swakarma hani of avrata, vata swakarma hani, no symptoms of vayu. Avarakasya tu, that which is covering, utsargataha, as it is increased much, swakarma vruddhir bhavati. If symptoms are manifested, swakarma vritti, uska काम बढ़ जाएगा. it will show its symptoms. तथा आवरणेन च आवर्यः प्रकोपितो भवति तदा स्वकर्मणां वृद्धि भवति इति व्यवस्था. आवरणेन च आवर्यः प्रकोपितो भवति. See, avaranena, avarya means avaraka is prakopita than the avarya. That is why swakarma vriddhi avaraka symptoms are seen. Anyetu avaraniyasya swakarma hani, same thing. And avarakasatu utsargato vriddhi. Prakopa of vata without its own cause. So this is very special in avarana. In rest of all the samanya vadis and nanatmaja vadis like rudrasi, pakshagata, ardita, etc., you clearly see the swahetu of vata prakopa. But this is the only special condition in Ayurveda where the prakopa of vata happens without its own hetu sevana. Why? Vata is prakrita, but what happens? The gradual avarana of the avaraka starts slowly. Accumulation of avaraka occurs only when the patient indulges in the hetu of that particular avaraka. There should be only that particular avaraka only. Hence, in avarana, there will be no history of specific hetu of vata. Absolutely no. Even though the resultant condition gradually may show you some vata vikaras, but nidanas are not having vata vardaka nidanas. On the other hand, if you take the history of hetu sevana, the avaraka will be available. Based on this, it can be inferred that avarana is the only condition where vata disorders are produced without indulging in the swahetu of vata. Now, symptom complex in avarana. Often the symptoms manifested are comprised of distributed functions of the obstructing substance as well as the obstructed vayu later. Like symptoms produced are based on the principles of three things. Reference Ashtanga Sangraha Nidana Sthana Adhyaya 60 where it is Vatarakta Adhyaya. 47 Shloka. The symptoms produced are based on three principles, that is Rupahani, Karmahani, Rupavruddhi, Karmavruddhi, and Rupantara is not directly to the shloka, but it is called as Anya Karma. Sometimes it may be, for example, see, Vikaro Dhatu Vaishamyam, Samyam Prakriti Ruchate. In the Vikara, it is Vriddhi, Kshayo, or Sthanantara Gamana. Three things are there. Ashapakarshi Hetu will also produce symptoms. That is why here clearly it is told that it may be either Karma Hani, either Karma Vritti, or it may be Anya Karma. Why we call Avarana as a complex clinical presentation? Because the symptoms are complex and it is always a diagnostic challenge. To identify the precise cause and the exact pathogenesis of Avarana requires special diagnostic skill and expertise. Sometimes it may misleads the patient because of its complex presentations. See, example. Very nice example given in the first chapter of Siddhisthana of Charaka. Read it carefully. How can this mislead you is beautifully given here. Medaha kafabhyam anilo niruddhaha. See, niruddha means avarana. If the meda and the kapha are doing the niruddha of vayu, anilo niruddhaha, blocking the vayu, shula angasukti shwayatun karoti. It leads to Shula, Angasukti, and Shota. Sneham to Injan Abuddha. Abuddha means ignorant. Galti se, by mistake. Tappininda. Now, Vatavadi in Tirukondo, considering it as a Vatavadi, if you use Snehan Upinjana Abudastu, Tasmaihi Samvartayet Devahi Tan Vikaran. So we have not seen the Avarana of Med and Kapha to the Vayu. We just saw the symptoms, that is Shula, Angasukti, and Shvayatu. But still we didn't doubt. As Shula was there, we thought it is Vata, and we used Sneha. What happens? The symptoms are increased. Samvarte tevahi tan vikara. Rogaha tata anyapi avitarkyamanaha. That is why while treating a disease, if you do illogical understanding, avitarkyamanaः, परस्परेण अवगृहीतमार्गाः, संदूषिता धातुभिरेव च अन्यैः स्वभेषज्येत् न उपशमं व्रजन्ति. The treatment will be failure. Even though you are giving the right medicine, the treatment will be failure because your diagnosis was wrong. You didn't see the avarana here. Next, diagnostic methods of pathology of Vata. Now, Kshaya, Vriddhi, Gatatva, I just said these are the three diagnostic processes. However, avarana requires a special diagnostic skill because it is complex. Sushruta mentions that the differential diagnosis between the conditions of pure Vata, Samsarga Vata and Avrata Vata can be made on the basis of their symptoms with the help of reasoning, yukti. Sushruta Chikitsa, chapter 5, Mahavata Vyadhi Adhyaya. Sushruta Samhita, Chikitsa Sana 5. Kevalo doshayukto va dhatubir avrto va nilaha vidneyo lakshanohabhyam chikitsascha avirodataha. Sometimes it may not be possible to diagnose the avarana and anyonya avarana directly. In that case, exclusion method may be helpful. How do you do exclusion method? When we say the two types of pittaja prameha with rakta pitta, we say that as the patient is not having any purrupas of prameha, then it is not the case of prameha. It may be the case of, means we are excluding something. If you cannot include, at least try the instrument of exclusion. That's also possible, told by the Sushrutacharya. Now see, here is the concept. How can something amurta vayu can do the avarana of its own amurta vayu? Bhagavata mentions that it is very difficult to diagnose the condition of avarana, especially if you see the error method. This is different shloka. Pittadivir tadvat mishranat anekada तारतम्य विकल्पाच्च याति आवृत्ति संख्याताम ताम लक्ष्येत अविहितो यथा स्वं लक्ष्येत शनैः शनैश्च उपशाम्य गूढ़मपि मूरु. So this is a different one. I wrongly told that it is about the avarana of the anyonya avarana. I'll change it. So here also to diagnose the avarana, we need shanaihi shanaihi, means little by little, upashaya, to understand the gudata, muhur, on and often. On and often, upashaya prayoga by little quantity can be used to confirm the diagnosis of avarana said by Bhagavatarya. Pittavrata Vata Lakshana. One by one we'll start the Lakshanas, and also we will see the treatments and how to understand clinically. See, Pittavrata Vata, if you see symptoms, Daha Trishna Shula Brahmastamaha, that means you may get misconfused with even Amla Pitta or Brahma, or sometimes there will be Pittaja Shula, because Charaka has not told Shula, Sushruta has told Shula. But to make a diagnosis, you use Upashaya. How? Katvamla lavanoshnaischa vidaha shita kamita. So if the patient eats Katu Amla Lavana and Ushna, there will be vidaha, which is same in Amla Pitta also. But Shita Kamata is there. Then you understand that the patient has Pittavrata Vata Lakshana. That's what I'm telling you. Daha, Trishna, Shula, Brahma, Tama, maybe in other diseases also. In other Pitta diseases also, Katu Amla Lavana Ushna intake will increase the symptoms. In other Pitta diseases also, Shita Kamata will be there. But how to diagnose avarana? Again, it's a special skill. Only many people cannot diagnose this. If at all Upashaya is there, you are giving the treatment of Amla Pitta, it is not reducing, then you understand that there Amlam cha Vidagdam Pittam is not there. There is to be something avarana. That's why you treat the avarana. The avaraka is Pitta can be treated by the treatment mentioned as Vireka, Kshirapana, etc. See, Pittavrati Visheshena, Shitambu Nam Tatakriya. How to manage? Shitambu Pana. Vyatyasat Karayet Sarpir Jivaniyam Chashate. See, Shita for Pitta, Jivaniya Sarpi for both the Pitta and Vata. Vyatyasat. Dhanva Mamsam Yavaha Shalit Yapana Kshirabasteyaha. See, Dhanva Mamsa, Jangala Mamsa Rasa can be given, Yava can be given, Shali can be given, Yapana Basti and Shira Basti. Because Basti is just for Vata, Shira Basti is just for Pitta, that is why Pitta Vrata Vata can be treated. Whereas Basti, Shira Basti and Yapana Basti is not there in the Amla Pitta Chikitsa. This is what is important to understand. There, Puram to Onam Karyam Pashchatu Murdi Virechanam, Kurtavanta Virekasha, there it is there the Anuvasayeta. But here it is Japanavasti and Shiravasti is there. Vireka is indicated, Shirapana is indicated by Panchamuli Balasutam. See, Lagu Panchamula and Bala can be used for giving the Shirapana. Madhuyasti Balataila Grita Shirascha Sechanam Panchamula Kashayena Kuryadva Shitavarinaha. So Pitta, see, first also Shita, second also Shita. You may ask me the question, then Vata will not increase or what? By Shita, Vata will increase or not? Answer is no, because Yoga Vaha Param Vayu. Vayu has mixed with Pitta, it will take the symptoms of Pitta only. It will be Ushna only. It will not be Shita. That's why to maintain that, nowhere Ushna Chikitsa is told. Shita, Mushnam, Tata Kriyam, Vyatyasa. When you see the Lakshanas of Vata more, later stage, use Ushna. When you see the symptoms of Pitta more, use Shita. That is why here the second line, Vyatyasa is important. This line, Vyatyasa is important. So one thing is not affected because both are opposite. One is Shita and one is Ushna. Even though mixture has caused Yogavahi property, sometimes something dominates. At that time, you have to use Shita Ushna as Vyatyasa Chikitsa. Kapha Vrata. As Kapha and Vata are both Shita, see, the previous one was Ushna Shita combination, but here it is Shita Shita combination. That is why there will be double dose of Shita. So that's why the first symptom itself is Shaitya. Gaurava, Vata, Shula, Gaurava Kapha, Vata, Shula. Katvadi Upashayo Adhikam. See, whenever he says Katu Adi, Upashayo Adhikam, the patient feels relief because Katu can increase Vata, but Avaraka is Kapha. That is why Katu first acts on Avaraka. That's why he feels better. And patient desires Kamita. What he desires, he wants to do fasting, he wants to do exercise, and he always wants to take something which is Ruksha and Ushna. If these are the symptoms, then you should understand that it's a Kapha Varta Vayu. How to manage it? Yavanani. See, Kapha Vayu. Go to Prameha, Kapha Vayu. Dosheshu Kshineshu Avakrishya. And the Lasika, Oja, everything has been brought to Meda, brought to Basti by Vata. Bhavavutta Meda, Bhavadravaslesh. Yava, Prayoga. Only one grain repeated again and again in Charak Samhita, in diabetes, Yava, Prameha, Yava. Jangala Murapakshi Mamsarasa can be given. Svedaha Tikshnaha. Why Svedaha Tikshnaha? First symptom is Shaitya. Both are Shita. So double Shita, go for Tikshna Sveda. Vata Shita, Kapha Shita, Tikshna Sveda. Niruhascha Vamanam Savirechanam. Niruha Vata, Vamanam Savirechanam, Kapha, and also Mrudu Virechana for Vata. Jeernam Sarpistata. So once it's all over, you can use Sarpi. Taila Tila Sarpa Sacham Hitam. Jeerna Sarpi, Purana Sarpi, commentary. Not Navina Sarpi. Navina Sarpi will increase Vata again. Sorry, Kapha. It may do the Avarana more. That is why Jeerna Sarpi. You know, Purana Sarpi Nunmada is Katurasa, Ugraganda. That's why it will not increase Kapha. It will reduce Kapha as well as it will reduce Vata. Tailam Tila Sarsa Pajaha, Tila Taila, Ushna Virya, Snigdha, Kapha Vata Shamaka. Sarshapa Taila, synonym itself is Katu Taila, Kapha Vata Shamaka. Samsushte Kapha Pityabhyam, Pitta Madhav Energy. Please remember this formula because these two Avaranas are important, Pitta Avarana and Kapha Avarana. Whenever you see the Pitta Kapha Avarana of Vayu, both doing Avarana of Vayu, the doctor should first give importance to Pitta, not Kapha, because Kapha is lethargic, inactive. Pitta is Agni. If you don't treat Pitta first, you will be doing mistake. That is why Charaka says in the last line, he gives you a clue. Samsrushti kafa pittabhyam, Pitta madhav vinirjayita. Adav. First you treat Pitta. So, Raktavrata Vata Lakshana. I took the slokas from Vatarakta because see the treatment here. Treatment is same as Vatarakta Chikitsa. Charaka says Vatarakta treated as a Vatarakta. Then somewhere in the inner conscious of Charaka, he might be saying that Raktavrata Vata and Vatarakta are having the same pathology. Because treatment is same. Now see, Raktavrate Sadaha Arti Twang Mamsantarajo Vrisham. Sadaha Arti Twang Mamsantarasho. In between the skin and the muscle tissue, there will be Daha Arti because the sana samshaya of this pathology occurs in between the skin and the muscles. Bhavet Saragaha, there will be redness, inflammation. Swayatur Jayante Mandalanicha. So sometimes there may be swelling as well as some patches, round patches, mandalas may also occur because the pathology has come and done the sana samshaya in between the Tvak Mamsantara. So inflammation increases and there may be some mandalas occurring on the skin. This is about Raktavrata Vata. Treatment is same as Vatarakta. Now, out of interest, when we go to 29 Chikitsa, shloka number 10 and 11. Vayuhu vivruddho vruddhena raktena avaritaha pati. Avarana word is used. Patha Srotas or path. The Vata's path is obstructed by the Vruddha Rakta. Not only that, I always tell my students the only disease in Ayurveda where there is Anyonya Avarana is Rakta Pitta. Sorry, Vata Rakta. Vata Rakta is the only disease in Ayurveda where there is Anyonya Avarana. See there. Here, Raktena Avarita Patihi. Vata's path is obstructed by the Rakta. And see here. Rakta Margam Nihantyashu. Rakta Marga is also blocked. Who? Shaka Sandishu Marutaha. Vata is blocking Rakta. Rakta is blocking Vata. That is why the second line. Nivishya Anyonyam Avarya Vedanapir Hared Asun. So it's such a deadly disease that if the Anyonya Avarana is not managed properly, the Vedana may kill the patient. Hared Asun. Vedanapir Hared Asun. So, Anyonya Avarana, only disease is Vatarakta. Look at the commentary of Chakrapani, what is Rakta Margam Niyantyashu. Raktasya Margam Marto Niyanti. Rakta Marga is obstructed by Vayu. Now, if I tell this, it is unscientific for many students who are in the webinar. But if I say air embolism, oh, it is scientific. What is Vayu obstructing the path of Rakta? What do you understand? The Vata obstructing the path of Rakta is 100% air embolism. They had this concept. And on the contrary, Rakta is doing the Avarana of Vayu, thromboembolism. Or some other part of Rakta where there is a more Skandana, Snigdhata, Pichilata, that's why it's obstructing the path of Vayu. And in Anyonya Avarana commentary, here the yellow colored third line, Raktena Vatam, Vatena Charaktam Avarya. That's what practically I'm telling you, because my presentation was asked to be clinical aspects of Avarana. Here, if you treat Vatarakta as gout, God bless you. Absolutely wrong. Even I was taught Vatarakta as gout. Many teachers teach students Vatarakta as gout. There is no any ama which is Vayuna Prerito Hiyamas Deshmasthanam Pratavati. Gout is, as per my knowledge, is Amavata. Because if you throw light on gout in the modern science, gout is a protein metabolic disorder where urine metabolism leads to excessive production of uric acid, which is not excreted from the body. More uric acid circulates in the blood. See, Vayuna Prerito Hyamas, Sleshmasthanam Pradhavati. It goes to the Sleshmasthana, that is Sandhis, and there it causes inflammatory changes. That means it is not Vata Rakta, it is Amavata. Then what is Vata Rakta? Clearly there is obstruction, Avarita Patihi. That means air embolism, thromboembolism, and other obstructive vascular disorders, Siragranthi, DVT, Burgers, TAO, trans and obliterans, all these can be considered as Vata Rakta. I have published an article where there was a embolism in the left hand of one patient, and we gave him Mandishta Diksharabasti, Tiktakshirabasti, Vetyasika Chikitsa, and the circulation improved. You can search that article, it's published, it is available online. So my understanding of Vata Rakta is not gout, it is obstructive vascular disorders. You may take it right or wrong, it is left to you, but I treat my patients of Vata Rakta based on the obstructive vascular disorders, not as per the gout. I treat gout as Amavata. Now to summarize this, all other, because it's impossible to cover 42 Avaranas in 2 hours. That's why I made a table where Mamsavrata Vata, very clearly, symptoms are there in the shloka, like Katina, Vivaranascha Pidakaha. See, when the Vata is Avarita by the, just simple common sense we have to use. Mamsa doing the Avarana of Vayu. So Vata is angry because its path is blocked and it's trying to come out, So gradually what happens? First day, second day, third day, fourth day, seventh day, 15th day, pushing Mamsa hard, there will be Pidakas. Means as you blow air in the balloon, it will bulge. Similarly, Mamsa will bulge. And that bulge itself is called as Katina, Vivarana, Pidaka. Why Vivarana? Because Vata is pushing it. Shvayatu, same thing. Vata is pushing hard, swelling. That is why Avarana, if you give time with calm mind, if you think logically, it's very easy. Or else it is Buddhi Avaraka as told in the first slide. Harshaha, see Vata when escapes, there will be Romanchana, has horripulations. Pipilikanam cha sancharaha, that's what, nothing but neuritis. Pipilikanam sanchara, the patient feels as if harsha, ants are walking on my skin. Iva mamsage. Treatment is Sweda, Abhyanga, Mamsarasa, Sneha with Dugdha. Swedana can be done because Mamsa Vayu, both Swedana Sadhyavadis. Abhyanga can be done when Vata Lakshanas are overpowering on the Mamsa, or else there are some Tailas which can be used for Mamsa also. Mamsa in a Mamsa Vardhanam, Mamsa Vrutti, that is Mamsa Rasa can be given whenever Vata is deteriorating Mamsa. And to balance both, milk with Sneha Dravyas also can be given. Medavrata. So here definitely we come across Medaroga, Staulya, Prameha, etc. In Medavrata Vata, Chalaha, Snigdho, Mruduhu, Shita, Shofo, Angeshu, Aruchistataha. See, Chala. Go to Staulya. The pendulous movements of Stana, Udara, Lambanam. Here also, the Abadha Medas is very much like a bubble of water. More Snigdhata, more Mruduta, more Shitata, edema, Shofa. Will be the symptoms. Along with that, Angeshu, Shofo Angeshu, Aruchistata. Patient may have loss of appetite, Aruchi. Adyavata iti dneha sakruchro medasa avrataha. Adyavata. See, Adyavata is also synonym of Vatarakta. Adyavata is also synonym of Medavratavata. There, one more Adyavata I have written here is, some people say Urustamba as Adyavata. Prayo Adhyanam Bhavati in Vatarakta. But Kapha Meda Avrata Vayu Urustamba. So here, Adyavata should be not considered as Vatarakta. Kudavata, Adyavata, that is different. Here, Adyavata should be considered as Urustamba. Treatment is very simple. Urustamba Chikitsa. I will throw light on clinical aspects of my experiences at the end of this presentation about Urustamba. So wait until at the end. Because this is, it will not take, it is not small enough to tell here only. I'll just finish off the Lakshanas, then I'll go to that person. Astyavrata Vata. So Sparsham, Asnam, Avrate, Tushnam, Pedanam means patient desires to be, these elders in the family, For the grandchildren, they will ask them to do press my legs and hands, comfortable massage. So Astyavrata Vata, naturally Asti and Vata are Ashraya Ashraya Bhava. So how to understand this also is a very big question. So the balanced ratio of Asti and Vayu is Ashraya Ashraya Bhava. If more Vata is collected and Asti is doing Avarana, then there will be Sparsham Asnavrutte Tushnam Pedanam. Patient desires that he should be touched by something warm thing. That means Swedana is necessary. Pedana, for comfortable pressure massage is needed. Abhinandati desires. Sambhajyate Sidati cha Suchibiriva Tudyate. Sambhajyate, as if somebody is crushing their bones, that type of pain. Suchibir, Sada, weakness, and also pricking pain will be seen. So for both Astyavrata and Majjavrata Vata, Mahasneha is the only treatment. Mahasneha is the only treatment. And if you want to try after Mahasneha, because Bahyabhyantara we should know the same Asti, different treatments. Majjavrata, same Mahasneha, but in symptoms, Vinamaha, see, patient bends. Jumbanam, excessive yawning. Pariveshanam, he feels as if somebody has tied his body. Shulam tu Pidyamanicha, Panibhyam, Labate Sukam. Again, same thing, just as Asti, if somebody presses his hands and legs, he feels Sukha. Here also Mahasneha. Shukravrata. Typical, because here Shukra leads to two things. Vata strong, Ativega. Vata weak, Avega. Shukra Avego, Ativego, Va Nishfalatvam Shukra gave only one line. Either there will be excessive ejaculation, either there will be no ejaculation. It's based on the karma of Vayu. And second one is obviously the 100% there is Nishfalata, unable to fertilize. Wife is absolutely normal. Husband cannot able to fertilize the egg of the lady. That's why Nishfalatvam. Treatment, very clearly, Harshana means Vajikarana. And Dasha Ahara, which increases the Shukrala Ahara, can be given. Vajikarana and Shukrala Ahara can be given. Shukra Pravartaka can be given. Annavrata. Bhukte Kukshaucha Rukjirne Shamyati. Very clear. Soon after eating, there will be pain. After digestion of the food, pain goes. So you decide whether it is peptic or duodenal ulcer. It's very easy. Soon after eating, there is pain. After digestion of the meal, no pain. Only one symptom, Annavrati Anile. So now see the different diagnosis. When the patient comes and tells you that, sir, soon after having the food, I have pain. And after the digestion of the food, the pain is absolutely gone. I feel all right. Now see, Annadravashula, Parinamashula, Annavrata Vata, different diagnosis. How to make logic? You have to be very perfect in that. Treatment, Deepana, Pachana, Vamana, and Laguahara. Mutravrata Vata. Again in Mala, everybody thinks Mala. One more question, why there is no Svedavrata Vata? If you are interested, anybody can answer in the group, or else I'll come to that point later. So Mutravrata Vata. Mutra Pravritti Radmanam, Basto Mutravrati and Lehe. So only 2-3 symptoms, that is Mutra Apravritti, dysuria, difficulty in urination, or completely obstruction of urine, apravritti. So once there is a apravritti of urine, urine is produced inside but not going out, Admana. The bladder extends beyond the pubic symphysis and Vata is going up. Because Shukrartha Shakramatra Garbhanishkramana is Vata, Apana Vata. So that also may be moving upwards, causing Admana. Basto Mutravrati and Le. Basti Admana. Not Udara Admana, Basti Admana. Definitely it is a collection of urine in the bladder. Mutravrati and Le. Only 2 symptoms. Apravritti of Mutra, Admana in the Basti. Treatment. Mutra Dravyas like Gokshura, Punarnava, Ikshumula, Ikshurasa, Mutra Sreshta, Swedana because of the Admana, and there will be some pain in the basti. Uttar basti to remove the Mutra Apravritti. That can be done. Vidavrata, big shloka. So Charaka has given more importance because there is logic for this also. Think it's very easy because the site of Vata, Tatrapi Pakwadhanam Visheshataha, Pakvasya, and Mala is also there in the Pakvasya. So the very commonest possible Avarana having more symptoms is Vidavrata Vata. Varchaso ati vivando adaha swe sthane parikrantati, see, parikartika. Ati vivanda or adaha swe sthane, both may be there again based on the taratama of vayu. Parikartika, 13 type of pain, just like fissure in that type of 13 type of pain will be there in the parikrantati, parikartika, vata cuts. Prajantyashu jaram sneho bhunkte cha anayhate naraha. Prajanti ashu jaram snehe bhunkte cha anayhate naraha. Anah will be there if you eat the ration and after sneha food. Chirat pidita mannena dukkham shushkam shakrit sujets. Next in Anna, dukkham shushkam shakrit sujet. Difficulty, dry, bala will be there. Shroni Vangshanam Prushteshu Pruk Vilomascha Marutaha. Pain will be there in the Shroni Vangshana, Prushta, etc. Aswastam Hrudayam Chaiva Varchasata Vrite Anile. So Aswastam Hrudayam Chaiva. Patient feels as if his heart is not swasta. Heart means Hrudaya is not just the heart. It is the urdhva part of the heart area, chest area. We feel aswasta if there is a avarana of varchas in the vayu. Iranda tela prayoga because it is anulomaka, snigdha ahara, and best is the treatment of udavarta. Whatever you are taking for the treatment of udavarta and trimarmiya, that you have to use for the treatment of vidavarta vata. Now coming to the general principles of management of avarana. Especially we have seen, but general principles, because nothing is specific here. We have to use your logic. Number one, I have divided into A, B, C, D like that. Vatopakrama may be applied with due care of obstruction to Vata and Shotas by Pitta and Kapha. This is general rule because Avarita is Vayu, Avaraka is either Pitta or Kapha. So treat both carefully with logical interpretation. The Avarana should be treated by the measures which are Anabhishandi. See, Pitta and Kapha are Snehi and more Sneha Kapha. Pitta is Snehi. So the general rule of treatment of Pitta and Kapha Anubandhi, Avarita Vata is Anabhishandi. Treat which are not Abhishanda, Ruksha. Next, Snigdha. Why Snigdha? Again, I said later stage, if you see Vata Lakshanas, Snigdhatha has been given. And Charaka beautifully says in the Vata Vyadhi, Kevalam Nirupastambita Snemacharet. If there is no Sangha, Gaurava, Supti, Ichilata, etc., go for it. Sneha. But if there is more Ama Lakshanas, Kapha Lakshanas, don't use Sneha. Third treatment is Shoto Shodhaka. Swedana is Shoto Shodhaka. Amapachana is Shoto Shodhaka. Virechana is Shoto Shodhaka. Pomana is Shoto Shodhaka. Nirovasti is Shoto Shodhaka. Anything, Shoto Shodhana in the form of Langana, Shoto Shodhana in the form of Langana Pachana, Shoto Shodhana in the form of Dosha Vasechana, anything you can opt for based on your logical understanding of the Avarana. C, in case of Vata is obstructed at all the places, Sarvasthana Avarate, then you have to go for Ashu Chikitsa, mentioned in the Charaka Chikitsa 28 to 39 shloka, which are regulation of Vata and at the same time not anti to Pitta and Kapha. Pitta Kapha avirodhi. Vata virodhi, Pitta Kapha avirodhi because it is Sarvasthanagata Avarana. So if you treat more for Vata, you may do the mistake of increasing Pitta and Kapha. So there clearly we can say that you should always take care of Pitta and Kapha while treating Vata, especially when it is Sarvasthanagata Avarana. Now, in the condition of Pitta Varta Vata, the treatment of Pitta, which is not antagonist to Vata, should be prescribed. Both references in 28 to 45. In condition of Kapha Varta Vata, the treatment of Kapha, which is Anulomana of Vayu to the Vayu, should be prescribed. That means it should be Kaphahara as well as Anulomana. Okay, like Haritaki, Shoshana, Kaphahara, Anulomana for Vayu. So there you have to treat both in one arrow, Anulomana and Kaphahara. Next. E. How to care the sthana of Avarana. I have given all the references. It will be too much, that's why I have not taken the slokas. Only important where I have taken slokas. So 198 sloka number in 28. If the dosha is vitiated, attains a great strength when it is situated in the normal swasthana, normal function means अपने own sthana, उसका स्थान पे रहता है तो they are first treated by the suitable medication such as Vamana or Virechana or Vasti or Swedana. Like you know the concept of Gatavata, the host should be treated first, then the guest. So here, the dosha gets attainment of strength in its own place. Then for Kapha, Vamana, Purgation or Virechana and Vasti and Swedana, anything. It's left to you. Which sthana the doshas are there. Kapha sthana, Vamana, Pitta sthana, Virechana, Vata sthana, Vasti, Sarvasthana, Pachana, Swedana, like that. Shodhana therapy is indicated based on the strength of the patient. If the rogi is balavan, like even in Vata Rakta we say, Rakta Pitta we say, Akshina Balam Amsasya, the rogi is balavan, strong enough to tolerate Shodhana, go for Madhura, Dravya Siddha, Anuvasana or Yapanavasti. Anuvasana or Yapanavasti. Mrudu Virechana should be administered as per Charaka Chikitsa 28 to 40. We can go for Mrudu Virechana also. Rasayana Prayoga. This is repeat 30 more minutes. So Rasayana therapy in Avarana, Charaka says at the end, Prasamiksha Baladikhyam Mruduva Sramsanam Hitam. So this Shodhana is done and Mrudu Samsana can be done. But when the stubborn cases of Avarana are there, especially two Rasayana are told, one is Shilajatu and one is Gugulu. And remember, these are the only two things told in the management of Stavalya also. Gomutra Bhavita Shilajatu and Agnimanta Bhavita Shilajatu. Agnimanta Bhavita Gugulu, one of my students has done the work last year, submitted. So here, Rasayana therapy, if all the Shamanaushadis and preventive Rasayana drugs are useful for the prevention of the treatment of Avarana in these disorders, especially Rasayananam Sarveshum Upayogaha Prasyasyate Shailasya Jatu Shirajatu. Atyartam Payasaha with lots of milk you have to give. Gugulustatha Lehamva Bhargava Prokta Rasayana. Bhargava Prokta Rasayana. It's nothing but some people call it Zamlaki Rasayana, which is Chavanprash also. But Bhargava Prokta Rasayana with you have to give to the patient. But two important rasayanas for Avarana are Shilajatu with Atyartha Payasa and Gugulu. Because both are Vata Kaphahara, Tridoshahara, Rasayana, Shruto Shodhana. That's why these two are told. Now coming to the point, what I mistold there, how can Vayu do the Avarana of Vayu? This is in the Sarvanga Sundara commentary of Ashtanga Hridaya, Arunadatta. See, Pranena Udana Avrute Nishwasa Uchwasa Samrodaya Sivu Udanena Prana Avrute Varnoja Bala Sankshayaha Syat. Nanucha Pittadivihi Pranadinam Avarana Yuktam. Now comes the point. Parasparam tu Pranadinam Yad Avaranam Tat Amurtatvad Anupapannamiva manyamahe. Amurtatvad. Where there is no shape and size, how can that do the avarana? It cannot be not understood. Brumaha. Dvayor vatayor anyonyam upasarpato balavata durbalasya abhidhatena gatibangat sa tena avarta marga ityuchate. Very important. See the commentary of Chakrapani also. Chikitsa commentary, not Chakrapani. Dalana commentary. Gati nirodham kuryat na avarakam ityuchate. So in Anyonya Avarana, it is impossible to cover one Vayu by the other. So what happens? The stronger Vayu does the Gati Nirodha of the weaker Vayu. Both Arunadatta and Dalana has said the same commentary, same meaning, that Vayor Vata Yoho, two Vayus, Anyonyam Upasargato, when they come against each other, Balavata, the stronger Vayu, Durbalasya Abhighatena, will obstruct the weaker one. Gati Bangat, there the speed of the weaker one is destroyed. This can be considered as avarana, not actual avarana. Covering is impossible because both are amurta dravya. I hope you understood this. So these are unknown avaranas are 20 in number. Go fast because these are all available in the books. You can read some lakshanas of these things. Pranavrata vyana. But the most important thing is clinical aspect. I was just questioned. I will tell all those things gradually. See, these Maruta, Panchanam Tani Samyak Pratarkayet. How to understand this? Because I just now said that Vata Avarana to the Vata is Amurta. So the first word Charaka says here is Pratarkayet. The Anyonya Avarana should be understood by Tarka, Anumana, Yukti. Sarva Indriyanam Shunyatvam Jnatva Smriti Balakshayam. The Sarva Indriyanam Shunyatvam. First, Prana is doing the avarana of Vyana. That's why Vyana is Kritsna Dehachari Mahajavaha, Gati Apakshepa Nekrimekshepa, Unmesha Nimesha Adika, Prayaha Sarvaha Kriyasasmi Pratibadhacharina. When we say there, Sarva Indriyanam Shunyatvam. Prana is doing avarana of Vyana. So some symptoms of Vyana should be there and some symptoms of Prana should be there. Smriti Balakshayat, Prana. Buddhi, Hrudendriya, Chittadruk. Vyane Pranavate Lingam, Karma, Tatra Urdhujatrukam. Treatment also is told in the shloka. So whatever is the treatment for Urdhujatraka Taroga, like Nasya, Shirovirechana, can be done in this concept of Pranavrata Vyana. Ulta, Vyanavrata Prana. See, Vyana is doing avarana, Vyana is strong, Prana is weak. So Svedo Atyartham, Lomaharsha, external Vayu, Vyana Vayu, moving everywhere. Krishna Dehachari Mahajava, Svedatyartham, Lomaharsha, Tvak Dosha, Supta Gatrata, all symptoms of the locomotor system and nervous system. Prane Vyanavrate Tatra, Snehayuktam Virechanam. So there, Vyana is responsible for the Rasa Samvahana. That is why Snehayukta Virechan should be given for the Vyana. Here we are not treating Prana. Now Pranavrata Samana. Imagine that the Prana is so strong coming down and affecting the Gati of Samana. What happens here? Jada, Gadgada, Bhukata. Actually, Vak Pravritti is Udana. This is where Avarana is very headache for people because you cannot understand where is this. See, Pranavrite Samane, Jadata, okay, agreed, because Ama formation, body is very stiff. Gadgada Mukata, where? The only logic I can give you is Prana coming down to Samana will even affect Udana because it is in between two. There only there may be Vak Pravritti, Prayatnorja, Balavarna Smriti Kriyaha. Maybe there. This is my just interpretation, hypothesis. Maybe right, maybe wrong. Chatush Prayogaha Shasyante Snehastatra Sayapanaha. See. Sneha, Chatusneha, and Yapanavasti is the treatment for the Pranavrata Samana. Samanavrata Pana. Just go fast. Samana Apane, Grahani. Obviously, Grahani dosha, because Agni. Strong is Samana. Apana is obstructed, means it is Gati change is happening. Parshashula, Hrudgada, Hudeva Vikara, Shula, Amashe. Treatment, definitely. Deepana and Grita. Deepaniya Grita, like Pipalyadigrita, Trayushanadigrita, Hingvadigrita, Hingu Savarchalagrita, anything which is stored in the Grahani can be treated. Now, Pranavrata Udana. Now comes see, Pranavrata Samana was there, but now coming directly to Udana. Shirograha, Pratishaya, Nishwasa, Uchwasa, Sangraha, Prana. Rudroga Prana. Mukashoshascha, Api, Udane, Prana Samprate. Now some symptoms of Udana. So here treatment is Tatra Urdhvakam Karvam Karyam Ashwasanam Tatha. Again, Urdhva Chatragata Vikara treatment and Ashwasana. Why Ashwasana? Because the patient has something like symptoms like Hridroga or Nishwasa Uchwasa Sangraha. He may be panicking that maybe I'm having a heart attack, difficult to respiration, dyspnea, Hridroga, something I feel discomfort in the testosterone area, Mukashosha. So in that condition, if at all the patient is having a panic attack, Ashwasanam is also told in the treatment of Pranavrata Udana. Ulta, Udanavrata Prana. Karma, Oja, Balavarnanam, Nasho, Mrutyuratha Picha. See, one more difficult point to understand Avarana is this one. See, Karma, Oja, Balavarnana, Nasha. Karma Nasha, Oja Nasha, Bala Nasha, Varna Nasha. Lastly, Mrutyu may also happen because Udana is affecting Prana. Prana is the main Vayu. That's why Mrutyuratha Viva. But look at the treatment. Udana Vrate Prane Tam Shanaihi Shita Varinaha. Just sprinkle cold water on the face. Sinchayet. Ashwasayetchenam Sukham Cheyopapadayet. Ashwasana and sprinkling of water. No any medicine. Absolutely no any medicine. Just Ashwasana, counseling, and Shitavari Sinchana on the face, in the body. So this is where we feel something we are not trying to understand. That is Avarana for us. Udana Vratapana, Urdhvagena, Avrate, Apane, Urdhvage commentary, Urdhvageti, Udane. Udana is doing the Apana, Avarana, Charti, Shwasadayo Gadaha. Vomiting, Shwasadi Gadaha, Pratilomeda Vayu, Shwasa. Survate Tatra Bastyadi Bhojam, Chayavan Lomanam. Basti can be given or Pramatya, Anulomana Bhojya, Deepana Pachana and Lomana Bhojana can be given because Apana should be also corrected along with Udana. There is a mistake in the typing. Here it is Urdhvage Apana Samvrate. Udana Vrata Apana. Here it is Urdhvagena Anvrate Apane. Here it is Urdhvage Apane Samvrate. Means Ulta. Apana Avarana doing of Udana. Moha Alpagni Atisara Urdhvage Apana Samvrate. Vate Syad Vamanam Tatra Deepanam Grahi Ashanam. So here in this condition you have mental confusion. Alpagni, Atisara, Apana symptoms as well as Udana symptoms. Treatment, Vamanam, because Udana is Purasthanam. It has gone to Apana place. Apana is doing Avarana. So remove Apana and do Vamana to establish Udana to its own place. Tatra Deepanam Grahi Chashanam. Vamyadbhanam Udavarta Gulmarti Parikartikaha Lingam Vyanavrati Apane. Snigdair Anlomayet. Snigdair Anlomana. So all these are given in the books. You can read it. I want to throw some light on this aspect of Chikitsa Siddhanta. This is again given in 28.217, 218. Very important. If we feel confused about the treatment of Avarana, then this shloka will help us because Sthanan Naveksha. Always see the sthana of Avarana first. Because Pranavrata Udana or Pittavrata Prana, Pittavrata Vata, anywhere in the body it can occur because all are circulating everywhere. Sthanani Aveksha. First see the site of affected. Very important. Vatanam Vriddhi Hani Cha Karmanam. Assess whether the Vata karma is Vriddhi or Vata karma is Hani. If Vata karma is Hani, Avaraka is strong, If Vata karma is vritti, Avrata is strong. Dvadasha avaranani anyani abhinaksha vishajjitam. These 12 avaranas, that first one, Pitta, Kapha, Anna, Rakta, Mamsa, Meda, etc. You have to understand the abhilaksha. Kuryat abhyanjana snehapana bastyadi sarvashaha. Abhyanga snehapana basti. Kravam ushnam anushnam va vetyasad avachareta. This already I told you. Vetyasa means sometimes ushna chikitsa, sometimes shita chikitsa. This will be especially happening in the Pitta Vrata Vata or Rakta Vrata Vata also, because Rakta and Pitta are Ashtra. Now I had asked one doubt where I had requested to even type if you are interested. I don't know whether somebody has written the reason for Sweda not causing Avarana. The answer is very simple, because Sweda is a mala of Meda which is exhibited external most of the skin, where there is no chance of any Avarana of wipe. Most of the Avaranas are happening inside. So Sweda is excluded because it is going outside. So Vata cannot be Avarita by the Sweda. Is just one small interpretation also told by my gurus in Jamnagar. So Vetyasika Chikitsa, you have understood for the treatment. Next one, there is one formula for Anyonya Avarana Chikitsa. See, this is very important. Whenever we feel confused about Anyonya Avarana, we can do this. What? Udanam yojayet urdhvam apanam cha anulomayet. चिकित्सा समझ में आता है तो एटलीस्ट इतना करो, बस काफी है. Just do this. If you feel that Udana is affected, urdhvam yojayet, bring it to its own place. Apanam cha anulomayet. Whenever there is apanadushti, go for anulomana treatment. Then he says, samanam shamayet cheva. Samana should be shamayet. Next comes Tridha Vyanam to Yojayet. Tridha Vyanam to Yojayet. Tridha means Trividagati, because Vata is, Vyana Vata is Kritsna Dehachari, moves all over the body. That's why whenever you have a Dushti of Vyana Avarana, treat it by placing in all the places. That means help it to move without obstruction to Urdhva, Adha and Tiryak Bhaga, Gati Apakshepa Apakshepa Nimesh Unmesh. So Tridha Vyanam to Yojayeta. Help the Vata to move by removing the obstruction of Vyana to move Urdhva, Adha and Tiryak. That's why Tridha. Prano. One more remaining is Prana. Rakshaha Chaturbhyo api sthane ki asya titirdruvaha. Prana treatment is very simple, that just protect it from other four. Finish. Just protect the prana from the other four vayus. Maintain its normal status. Sthane hi asya sthite dhruvaha. Swam sthanam gamayedeva vrittanetan vimargagan. So if it is in the swasthana, then the vritti, swastha vritti is there. Vimarga, it will cause the disease. These are some symptoms of Pitta and Kapha doing the Avarana of Pranavayu, Pitta and Kapha doing the Udana, Pitta and Kapha doing the Vyana, Samana and Apana. I don't think I can handle all these things because there is a shloka there. You can see the symptoms. I just move on to some very important aspect. Rasayana is over. Okay, Prameha. Because I was told practically, and it is very practical, you get the patients every day in your clinic. If you are a Kaya Chikitsa or Panchakarma or expert who is a practitioner, anybody, if you are getting patients of diabetes, which is Prameha, you will get both the things what I have told you. Both the things are told here in this concept, that is, see, in Nidana Sthana, Dhatu Kshayakaraka Nidana of Prameya is told, like Kashaya, Katu, Tikta, Ruksha, Lagu. Please see the reference. I don't have time now, but in 37 shloka, not even single Nidana is of Santarpanata Vikara. All the Nidanas, Vyavaya, Vyayama, Vamana, Virechana, Asthapana, everything is Dhatu Kshayakaraka Nidanas. Whereas look into this Samprapti, where in the chapter of Kiyanta Shirasi Adhyaya, Sutra Sthana 17, Look at the Nidanas. Guru Snigdha Amla Lavana Atimatram Samashnatam. Exactly opposite. All are Santarpanatta Vikaras. I mean Santarpanatta Hetus. Navamannam Navam Chapanam Nidra Master Sukani Cha Tekta Vyayama. There it was Vyayama and Vyavaya. Here it is no Vyayama. Achintana. No doing Chinta. No Shodhana. Shodhanam Akurvatam. Sleshma, Pittam, cha Medascha, Mamsam, cha Ati Pravardate. By all these Nidanas, there will be Ati Pravardana of the Kapha, Meda, Mamsa, and Pitta. See the yellow color marking. Taihi Avratagatihi Vayu Oja Adaya Gachati. Clear cut Avarana in type 2 diabetes. Tula Pramehi, Santarpanatta Prameha, not Krisha Pramehi. In Krisha Pramehi, the Nidanas are Dhatukshayakaraka, whereas in Stula Pramehi, the Nidanas are Avratagatihi. This Vayu takes the Oja to the Basti. Yada Bastim Tada Kruchro Madhumeha Pravartate. So here it is Madhumeha. So what is the indication here? See, these are some of my patients who were taking insulin prescribed by the so-called endocrinologists. I don't know the logical behind giving them the insulin, but I said, your weight is more than 75-80 kgs. You are having so much of Prabhuta Kapha and Meda in your body. So according to Ayurveda, you are not supposed to take insulin. Then they started fighting with me. Are you more smarter and intelligent than the endocrinologists? Then I said, okay, fine. If you think I'm not smarter, then get one test done. And I wrote them serum insulin. So they came back with the report. I showed them that the normal insulin level is 24.9. Now your insulin is 31.2, which is more than normal. Second case, 39.37. Again, insulin is increased more. Third case, 113.8. 113.8. Serum creatinine 2.36. But still doctors are giving insulin. I don't know their logic, but according to my logic, it is not correct. It's unethical. Maybe they have different reasons that, okay, this insulin is not active, so I'm giving you this insulin. Something human ectopid, I don't know. I'm not an allopathic practitioner, but still, as per my knowledge, insulin is an anabolic hormone. You can search in your mobile, you can search it. I did this to my PG students last 2 days back. Insulin is an anabolic hormone. So already there is a patient is Stula Pramehi. If you are giving insulin again, what will happen to Staulia? The patient will increase Staulia, anabolic hormone. And look at the levels of insulin already there in the body. These are all my patients. I have done it in Bijapur only, Karigot lab or Sadashiv lab. So when normal is 25, you have 113 and still you are taking 3 times insulin. 14 units, 12 units and 10 units. Professor of Engineering College, I will not tell the name, it's unethical. BLD Engineering College. So what exactly happening is, there is something called as hyperinsulinemia with hyperglycemia. Both are together existing because you have some receptors failure. Insulin resistance is there. See, these receptors, they are blocked. Why they are blocked? Maybe you call it as free radicals or they are deactivated. When I say this, it is scientific. When I say AMA is blocking the Shotas, it's unscientific. And to surprise you all, last year when I was the PhD review committee member of BLD Medical College, so among 2 people who were non-allopathic, we were the members of the PhD review committee of allopathic college, BLD Medical College. One professor of medicine after MD, while doing PhD, he took a topic. If you listen to the topic, you'll feel very proud that our acharyas were so scientific thousands of years ago that in 2024, this doctor in medical college is doing a research on effect of therapy of diabetes comparative to obese diabetic and non-obese diabetic. What is this? Stula Pramehi and Krisha Pramehi. So at least now they are understanding that what Charaka said thousands of years ago about Stula Pramehi, obese diabetic and non-obese diabetic, now they are doing PhD on that topic. That means there is absolutely no necessity of giving insulin in type 2 diabetes. You have to make the body utilize the produced insulin by the. Yeah, I do agree. There are limitations of Ayurveda where if the insulin production is absolutely gone, if your islets of Langerhans, alpha cells, beta cells are completely gone, if you're a type 1 diabetic, then I too say, please go ahead with insulin. We can just give some rasayanas or some medicines which can support you, but absolutely you have to take because type 1 is asadhya, madhumaya is asadhya as per Charaka. Jata pramehi, madhumehi, navana, sadhyakta, bija doshas. Bija doshas are there. What we can do? There are people who claim that I have treated all the types of diabetes. No, we as people should understand our limitations. So once we give Shodhana, Shodhanam tasya dosha baladikasya, there the Avarana is removed. Because if you see the Nidanas of Avarana, last slide, all Guru, Snigdha, Amla, Lavana, etc., all Santarpanata Vikaras are there. So go for Virechana, go for Udvartana, go for Rukshana. Obviously, we're not giving it's a little bit contraindicated. Go for Vamana, go for Virechana, Udvartana. Okay? So Kapha Medhora Chikitsa, Sirajatu, Shivagutika, Gugulu, Chandrapavati, Sirajatadivati, Gomutra Haritaki, Asanadi Kashaya, many are there. Plenty of medicines are there where they are Kapha Medhora. So there, if you do the Shodhana, the insulin receptor blockading free radicals, what we call, they will be removed by Shodhana. And then the insulin receptors get active so that the produced insulin can be let inside the cell membrane by the, because that is, the receptors are utilizing the cell, the insulin is utilized by the cell by the help of the receptors. Then you will not have hyperglycemia with the hyperinsulinemia. So this is what Avarana plays a role. Now, Urustamba. We have some cases where our diagnosis is like, see, Charaka only said, so I will not be ashamed of saying that. Charaka only has said that you cannot name all the diseases in the world. It's impossible to name the diseases in the world. So I say sometimes there is a, demyelinated neuritis, Guillain-Barré syndrome, paraplegic, or some types of myasthenia gravis. Last week only when the patient came with bilateral, means both the legs not working properly. He can walk, but he cannot sit and stand without support. Somebody should. So much of weakness in the legs. So I termed it as Adaranga Vata. I don't care with what is the modern diagnosis. Adaranga Vata. Still, if you see here, clearly in Urustamba, Charaka Chikitsa 27, Rudva Ashu Gauravad Uruhu, Rudva Avarana. What? Meda, Fa. Brings the Vata to the Uru. That's why Panchakarma is totally contraindicated. Gaurava Ayasa Sankocha Daha Ruksti Company symptoms. Avarana. In this condition of symptoms, even in Urustamba, where there is Meda Kapha Avarana, Sthana Samshaya and Uru, if symptoms imitate Avarana, but still if you understand that Vata Shanki Viradnyanatasya Snehayet Punaha, same thing what is told in Siddhasana first chapter. If the doctor doubts about the Vata Vyadhi and gives Sneha again, Padayoho Sadanam Supti Krichrad Uttaranam Tadaha. See, there will be Pada Supti, Pada Sada, and the treatment becomes more difficult for the doctor. So you have to understand whether it is Avarana or Dhatukshaya. Symptomatology. 2 of my patients in my lifetime, just 20 years of practice, 2 to 3 patients only, have told one sentence. Sir, Nanda Kalu, Nanda idan Tansavaldu, Nan Kal and Mat Kelavaldu. In English, for so those who are not Kannada people, sir, my leg is not a feeling it's my own. It is not listening to my orders. That movement is not possible. See the word used by Charaka. अन्य नहीं हो, दूसरों का पैर है. अन्य नहीं हो. The patient feels that as if the patient's leg is other's leg, not my leg. Sambhagno, as if it is fractured and completely useless. Uru padocha mannate. as if there is a fracture of Uru and Pada, that it's not listening my word, it's completely dislocated or fractured and it's not useful. Like that he feels, same symptoms some patients will tell me. Sir, chappli kitonu gottagodilla. They will be coming home and wife asks why there is only one chappal in your hand, in your leg. The other chappal has gone somewhere. He is not aware because there is so much of supti, numbness, neuropathy. So all are related. Diabetic neuropathy is there, GB is there, demyelinated neuritis is there, okay, myasthenia is there. So many conditions are there where there is a muscular dystrophy and other conditions of neuropathy where Jangoru Glaniratham Shashwachadaha Vedana Padam Chevetinastam Shita Sparsham Navetija. Shita Sparsham Navetija sensory. The patient will not able to feel the touch of cold. Shita Sparsham Navetija. Patient is not possible to samsthane, pedane, gatyam, charane chapi. He cannot move his legs. So because of that, he feels my leg is not mine, it is others. So in that condition of Urustamba also, Avarana Chikitsa, na Snehanam, na Swedanam, I mean, Swedana is there, no Vamana, no Vireshana, Tatra Samshamanam, Nityam Kshapanam Shoshanam, Rukshopacharaya, exercises are told. So to finally conclude, exactly we are having 4 minutes. Here in this presentation, a sincere effort, I call it as Gustaki because it's very impossible to understand Avarana in 2 hours, but trying my level best to do justice to understand the unique concept of Avarana, of Vata by analyzing the textual references from different angles of Charaka, Shushta, Bhagbata, both Astanga Sangra and Hridaya. So the understanding of applied aspect of Avarana is very important when it comes to clinical practice. Without that, we may do some mistakes in the clinical practice. And obviously, Upashaya, Anupashaya, Abhyam, Gudalingani, you have to understand. So it's okay to commit mistakes, but you have to be smart enough to learn from your mistakes. So next time you are not do the same mistake. You'll say, okay, no, it's not this one, this is Avarana. So I'll treat it like this way. I'm telling this because it's a very complex mechanism and it needs very patience, logical interpretation in the diagnosis. And also, whatever the disease is caused by Avarana, till now what we learned can be to some extent managed by Shodhana, like Shodhana and Shodhana, Vamana Virechana plus Shamana Chikitsa, just like in Urustamba, no Shodhana, only Shamana, Rukshana, Shoshana, and Rasayana like Shilajatu and Kukulu. So, thank you very much. I wholeheartedly thank the principal, Dr. Ganige sir, and all the faculty of Panchakarma department of the prestigious TGMC Bangalore, Bellary, sorry, for giving me this opportunity. And over to the organizers, if there are any Q&A, try to answer it possible.
Sir, questions are in chat box.
Thank you very much, sir, for your.
Can I take myself or you will just?
Sir, I will read the question, sir.
Okay.
Okay. Thank you very much, sir, for your enlightening and insightful and thought-provoking lecture. Your lucid explanation of the fundamental principles of Avarana, along with its practical clinical application, has greatly enriched our understanding. I hope that our guest speaker has decoded Avarana. Sir, next question session interaction will be start. Sir, first question is, does Srodhodushti always precede Avarana or can Avarana occur independently of significant Srodhorodha?
Yes, absolutely. It's a very practical question. Srodhodushti and Avarana may not coincide together. They may occur independent also. It is not necessary for the Avarana to be preceded by the Srodhodushti because there Shodhana can be of any Shodhas, but here Avarana is only for the Vata. That is why there may be independent Avaranas without Shodhana. Okay.
Okay, thank you, sir. Next question, sir. What are the most common clinical conditions in modern practice where Avarana is overlooked?
Yeah, I just told, I think, Stamba, Prameha, Vatarakta, and maybe some Guillain-Barré syndromes, even hypothyroidism, there Avarana is there, PCOD, Avarana is there. Now it is PMOS, not PCOD, PMOS. So there are conditions like these: obesity, dyslipidemia, GB syndrome, muscular dystrophies, etc. can be, one thought can be thrown to diagnose whether it is Avarana or not.
Thank you, sir. Next question, sir. Sir, concept of Avarana and how can Ayurvedic principles be integrated into their management?
In my clinical practice, most practice two conditions, that is PMOS and diabetes, where I just gave you the reference of people giving wrongly insulin. So there we do Shodhana, Udvartana followed by, means Ruksha Virechana. Just 7 days Udvartana followed by Virechana. On the 7th day, no Snehana because already patient is Abhishanti and heavy Snigdha. So sometimes if we feel that Snehapana is indicated, then we go for some Snehas which are not too much of Kaphamedo increasing like PTGG or Dashmudagrita, etc. or Vipaladigrita, Ingusavachalagrita, not available in the market, but still some practically we can use. And then the most successful rate in our clinical practice is infertility due to PMS. Almost 10 to 15 people have conceived after Virechana, followed by some other Gugulu, Shivakutika, Chandraprabhavati. My PG students know this. Ours is a Kaya Chikitsa OPD, but it is more having gynec disorders. So these two conditions, I can bet on that. I can invest my money where you can treat as per the principles of Avarana.
Thank you, sir. Next question, sir. How does the presence of Avarana influence the choice of Basti?
Again, if you take the example of Medoroga, Staulya, Prameha, or actually Prameha and Kushta, Basti, not directly indicated, but you can use it. So wherever there is Avarana, there are specific Bastis told. For example, if a patient is Asadhya Avastha or not indicated for woman and Virechana, there these Bastis are very much helpful, which is called as Ardha Chikitsa, like Lekana Basti, Irandamula Niro Basti, Gomutra Kshara Basti, etc. are wonderful in treating the Shoto Roda of Avarana.
Thank you, sir. Next question is how to understand concept of Avarana in motor neuron diseases and their management.
Not all motor neuron diseases are Avarana. So practically, if even though we are treating MNDs, sciatica or upper motor like Ardita or Ardhangavata, etc. There only if there is Shotha, pitting edema in the affected hand and leg, Supti, Stamba, Gaurava, etc. There only the role of Avarana comes. Or else, if it is not a Upastampita Vata Vyadhi, there we don't think about Avarana. But definitely, there are some symptoms like Gaurava, Supti, Tandra, etc. There, obviously, we think of Avarana, but our Chikitsa is again same. Because even in Avarana also, Shodhana, Shamana is told. There also Shodhana, Shamana is told. So in MNDs, if at all the MNDs are associated with the Ayurvedic symptoms of Gaurava, Stamba, Supti, etc., there you have to go for Chikitsa of Avarana.
Thank you, sir. Next question, sir. In clinical practice, how can we differentiate between a disease caused by Avarana and one caused by Dhatukshaya when both present with similar symptoms?
I think it's very easy. Even though the symptoms are same, First, assess the nidanas. That's why history taking is very important. Assess the nidanas. Assess the dosha dhatu vrittiksha lakshanas in the patient. Just now I told in the first sloka that cha word is there in the vayor dhatukshayat and margasya avarnena cha. So only those patients which are not having a clear-cut differentiation of margavarana and dhatukshaya will be confusing, but still you can go for upashaya chikitsa there. So if you consider it as confusing, as told in Sandigata and Namavata, go for Snehana chikitsa. Go for Santarpana chikitsa. If at all you feel relief, then you understand that the cause may be dhatukshaya. If at all the symptoms are not reduced, and if you get some aggravation of the symptoms, then you understand that Margavarana has overpowered dhatukshaya in this condition. So there you have to treat Margavarana. That's it.
Thank you, sir. Next question, sir. What practical clinical indicators or examination findings help in differentiating between dosha avarana, dhatu avarana, and mala avarana during patient assessment?
I think the answer is very simple, that all the lakshanas are given in the text, Charak Samhita. All these what you told are given there. So that's why I told in the beginning that we have to be very attentive and very logically active to understand this. But most of the time, including me, even my gurus said that avarana is avarana for me also. So I can understand the enthusiasm of the audience, because I expected many questions, because this is one topic where there are lots and lots of questions, including for me also. So I say sincerely that practically it's very difficult to see the patients like this, but still based on the classical shlokas given in the chapters of Shuraka Shushulamata, we can try to understand whether it is dosha avarana, dhatu avarana, or mala avarana.
Thank you, sir. Next question, sir. Can avarana be identified based on the presence of single lakshana, or should be diagnosis rely on combination of all lakshana?
It is very difficult to diagnose the avarana by single lakshana. It's not possible because it will be so confusing. That is why you need at least some, what you call, you should be very confirmed by saying that, okay, these are the things that I will be seeing, that it will give me the diagnosis of the disease. But only single lakshana, no, absolutely not.
Thank you, sir. Next question, sir. How can the concept of Avrita Vata be understood and interpreted using modern diagnostic parameters such as ESR, CRP, CBC, MRI findings, like hematoma or in fact muscle hypertrophy or atrophy, extra evidence of degenerative changes and intervertebral disc pathologies? Can these investigations help in identifying the type and severity of avarana?
It's a huge question. Okay, very huge question. It's very easy to ask questions, but practically when to say ESR, CRP, CBC, this only you're telling, no? How can your concept of avarana can be understood in?
Yes, sir.
Are you telling this one, hematoma, infarcts, etc.?
Yes, sir.
Yeah. So see, ESR, CRP, CBC, better not to compare. Better not to compare, because our science cannot diagnose on this basis. But when you say MRI findings and CT scan, yes, there is some scope. Because whenever there is ischemic changes in the patient's MRI, the brain, I'm telling you, there you understand it is avarana. Because the ischemia caused for the micro arteries of the brain are completely, either they are stenosed or they are blocked. There is something like a clot is there, or kapha is doing avarana, atherosclerosed. So there definitely avarana is there. Whereas if you see the nidanas of Vata Vyadhi in 28, doshasrak sravanadati means, doshasrak sravanadati means vamana kapha sravana, virechana pitta sravana, rakta mokshana, rakta sravana. Asrut So why you are going for only Rakta Sravana, Rakta Mokshana? Any injuries where there is a excessive blood loss or even there is a hematoma formation. There also, if the hematoma is a space occupying lesion, then it's coming as Avarana. But if there's a blood loss, severe blood loss and leading to some Vata Vyadhi, there definitely Ativamana, Ativirechana, Atiraktasrava, even sometimes Ativavaya also, where there is Dhatuksha Lakshanas, that also can be understood by understanding the symptoms only. But for CT and MRI, clearly only these two.
Next question, sir. Next two questions is there, sir. Yadi hasti tadan yatram yana hasti na tat kvachit. This is true in the present scenario also. In today's clinical practice, we get so many autoimmune disorders, whether this can be placed under Avarana Janya Vata Vyadhi.
Not all autoimmune disorders. When you say autoimmune disorders, which one you want to put under this? For example, Amavata, autoimmune they say. Psoriasis they say autoimmune. SLE they say autoimmune. There are some different conditions. But not all the autoimmune disorders will have Avarana Vata Vyadhi. These are completely Oja related. And if you try to find and analyze the Oja Vishwamsa, Kshay and Vyapat, you may find some symptoms. But autoimmunology and Avarana, because see, diabetes, hypothyroidism, they are not autoimmune, they are endocrinal. So there, whatever symptoms I gave, examples I gave, those are only can be understood as per my understanding. But autoimmune and Avarana, my experience is very less in this.
Next question, sir. How would you differentiate Kapha Vrata Udana Vata from Tamasa Pradhana Manovikara presenting with similar symptoms? How would you differentiate? Sir. Udana Vata from Tamasa Pradhana Manovikara presenting with similar symptoms.
Yeah, I think very easy. History taking. See, for example, this is somebody who is interested in Manas Rogamayata's question. So my understanding of this is Tamas Pradhana Manovikaras are of the person who is always having negative thoughts and who is in a depressed mood, Tamas and Kapha together. So just ask the lifestyle. If the patient is having such a negative thoughts, always antisocial element, being lethargic, sitting in one place, not mingling with anybody, always having all, antisocial elements, then definitely you can differentiate. If these symptoms are not seen in the history, the relatives will tell that, no, he's very active, he doesn't have any negative thoughts, he's fine, he's mingling with everybody, then you have to doubt about something called as Avarana. It's very easy.
Thank you, sir. I hope all the participants got their answers. As we come to the end of this enriching academic session, it is my pleasure to propose the vote of thanks on behalf of the Department of Panchakarma, Tarnath Government Ayurvedic Medical College and Hospital, Ballari. I express our sincere and heartfelt gratitude to our esteemed speaker, Dr.Sanjay Kadlimatti, sir, for sharing his valuable knowledge, vast clinical experience, and scholarly insights on decoding Avarana from fundamental principles to clinical practice. Our sincere thanks to our respected principal, you all for your valuable time and presence. Thank you, Varunda.